Hello, and welcome to the Community-Based Organization Wraparound Self-Referral Consent Form Training. My name is Kate O'Donnell, and I am the Safety Net Lead for the Community Engagement Team at the Oregon Health Authority. Today's training is for community-based organizations like yours. We are going to be talking about the Oregon Health Authority's COVID-19 grant focused on wraparound and support services. Specifically, we'll be talking about what you do when a person approaches you directly for help but is not referred by the local public health authority. We'll talk through the process and the consent form that you'll use in these cases. Here's our agenda for the training today. First, we'll start with a language check to review some of the terms that we use in the training, and then we'll talk through the self-referral process and consent form. Let's start with our language check. Throughout the training, you'll hear me use the term CBO or community-based organizations. That's you. This is the term we use when we are talking about organizations like yours. Usually this means a nonprofit organization that serves community members. You'll also hear me say LPHA or Local Public Health Authority. You may know this entity as your county public health department. They're the government organization that provides things like immunizations, food safety inspections, and reproductive health services. Your local public health authority is your local leader in your COVID-19 response. We'll also use the terms quarantine and isolation. These are the terms that we use when talking about people staying away from others if they have been exposed to COVID-19 or if they have a known case of COVID-19. Quarantine means staying away from others when a person has been within close contact of someone else with confirmed COVID-19. Isolation is staying away from all other people after testing positive for COVID-19 until the illness has met the definition of resolved. Your local public health authority will let you know when the case has been resolved. So what is the timeline for isolation and quarantine? Typically, it's around 14 days. The local public health authority or the person's healthcare provider will let the person know when the window is that the person should be in isolation and quarantine. Sometimes that timeline is longer than 14 days, and the local public health authority or the person's healthcare providers will let them know. If a person needs wraparound services beyond 14 days, and you want to provide them with those services, reach out to your Community Engagement Coordinator or CEC for help. So what do we mean when we talk about wraparound support services? That's really what this training is about. In this context, we're talking about how we get people who need support some help when they are experiencing challenges related to COVID-19 exposure. This means getting people the things that they need right away to stay in isolation and quarantine, things like rent, utilities, childcare. This is one of the things that makes our grant special. We can pay for some of those things out of pocket to keep people in isolation or quarantine for those 14 days and help slow the spread of COVID-19. This is different than safety net. So when we talk about safety net programs, we're talking about existing programs and services that help people get their basic needs met. Things like SNAP, the Supplemental Nutrition Assistance Program or food stamps, the Oregon Health Plan or Medicaid, or unemployment insurance. These are programs that were here before COVID and they will be here after COVID. And they're things that can help someone after their isolation and quarantine period is over if they need help with things like housing, food, or utilities. Now that we've checked our language, we'll talk about the self-referral consent form and the process. First, a quick note. We are going to talk through the general process for these requests. These are processes and forms that were created by the Oregon Health Authority as a resource for community-based organizations and local public health authorities. However, your organization and your local public health authorities might have a different process in place or may have tweaked this so that it works better for everyone locally. You should talk with your local public health authority to figure out what works best for everyone. Sometimes this is already written out in your Memorandum of Understanding, or MOU, that you have signed with your local public health authority. The process may look different depending on the needs of you as the CBO, your local public health authority, or the person who needs help. It may also grow and change as we learn and work through these processes. As you talked about in the Wraparound 101 training, many times you will receive referrals for wraparound services directly from your local public health authority. But in that same training, you also talked through what happens if someone comes directly to you, the CBO, and asks for help, but is not referred by the local public health authority. When would this happen and why? Part of why your organization was chosen for this grant was because you already have great relationships in your community. You are trusted by people who use your services, and you hear from folks who need help. You might be a shelter, a cultural organization, a sober living facility, or a mentoring organization. Chances are you might hear from folks who are experiencing challenges related to COVID-19. Maybe you hear from a community partner that someone needs help, or there is an exposure among one of your clients. In this case, the person knows that you are a good, trusted resource for help, and so they may go directly to you before the local public health authority has a chance to reach out to you. So what do you do if a person comes directly to you and is not referred by your local public health authority? You may remember from the Wraparound Basics training that your first step is confirm the person's COVID exposure and give wraparound support. You need to confirm the COVID diagnosis or their exposure to COVID with a local public health authority. This is where the consent form that we'll be talking about today comes in. You need that form signed so that you can work with the local public health authority to confirm that person's COVID status. In the meantime, while you wait to confirm this information, you can begin to offer this person short-term wraparound support. What do they need right now to stay safe in isolation and quarantine? You, the CBO, have 5 business days to help this person while you wait for the local public health authority to confirm the person's COVID status. Remember, confirming the person's COVID status is important because that is what allows you to pay for the short-term wraparound needs such as housing, food, and utilities that the person needs while in isolation and quarantine. If the community-based organization can't confirm the person's COVID status, the CBO can't pay for these costs beyond that 5-day period. So it's really important to get that COVID status confirmed. One form that we've developed to help with this process is the consent form for self-referrals. We created this form so that the community-based organization can get permission from the person they are helping to share their information with the local public health authority. We're going to walk through these different parts shortly. But why would you use this form? The form is meant to help you as the CBO, but you actually don't have to use it. It's an example to be a resource for you. You may already have a consent form as part of your normal services that you deliver, or your local public health authority may have a different form that they have asked you to use. In either case, this form that we've created can be a resource and a guide, and that's the one that we're going to walk through today. Really, the purpose of this form is to make sure you have told the person you are helping that you will be sharing their information with the local public health authority, and that you have this consent documented somewhere. You will need to share this information so you can confirm the person's COVID status and get them what they need. Really, it's to help protect the person you are helping and protect your CBO. Here's what our consent form for self-referrals looks like. We'll walk through the different parts of this form now. You can help the person fill out this form. First, put in your information, the name of your CBO and the name of the staff person helping fill out the form. The second part, where it says person requesting services information, you will get as much information as you can about the person asking for help. The local public health authority will need this information to confirm that they have the person in their system. Ask for the person's name, date of birth, phone number, and address if known. Document the date that they came to you asking for help. Lastly, if the person that you are helping hasn't been diagnosed with COVID themselves, but they know that they were exposed to someone with COVID, get as much information as you can about the person who exposed them. We know this can be tricky because the person that you are helping may not have all this information. Just do your best to get what you can. The local public health authority will need this information to confirm that they have the contact in their system. Below that chart, this is the actual consent that the person is signing for. Essentially, it allows you, the community-based organization, to share the person's information with the local public health authority. I'd like to note that you may not be seeing all of your patients in person. And also, people often do not have access to computers, phones, or printers to actually sign a physical copy of this form. So there are a few ways that the person can sign the form above, where it says signature. They can sign on a paper copy given to the community-based organization. So you, the CBO, could print out copies and physically give them to people to sign, or the person could print out a copy on their own paper and give it to you, the CBO. Because many people don't have printers, if the person has access to email and a computer, the person could also sign the form by typing their name in the box or pasting a picture of their signature onto the form, and then send it to the CBO electronically over email. Many people also don't have access to a computer or email or word processing software. And so in these cases, the person can also give verbal consent. This is when the person agrees to sign the form over the phone, and the CBO staff person would write their name in, so they can remotely sign their consent on this form. The CBO would then save a copy of this form for their records. After the consent is received, the CBO would approve the request by signing it and then sending it to the local public health authority for approval. The local public health authority will then make sure that they can find the person in their system to confirm that the person is a known COVID case or that the person has been in contact with a known COVID case. If the local public health authority can find the persons in their system, they will approve the form and you can continue paying for wraparound expenses. If the local public health authority cannot find the person or their contact in the system, they cannot approve the form, and so they will deny, and then the CBO cannot pay for any more wraparound expenses for this person. Instead, the CBO could work to connect the person with existing safety net programs or other grant-funded supports to help them meet their needs. So what do you do with this form? First, we want to make sure that you do not send this form directly to the Oregon Health Authority. We would ask that you keep a copy for your records. And then, primarily, the goal of this form is to send it directly to the local public health authority. And we want to make sure that this is sent to the local public health authority in a secure way to make sure that the client's information is kept private and confidential. What does secure method mean? It means that it protects the information on the form from being accidentally shared with someone who should not see it. For example, another staff member, hackers, or member of the public. How do you send something via a secure method? There are a couple of ways. First, the local public health authority could initiate a secure email to you. You can then reply to the secure email with the form. Maybe your CBO has its own secure email software. In that case, you can initiate a secure email and send it directly to the local public health authority. If you don't have access to this technology, there are a few other ways that you could make this work. One is in which the CBO sends this form to the local public health authority through a fax. If that doesn't work or you don't have access to a fax machine, some CBOs and LPHAs have actually worked out a process where they can share the information on this form over the phone. And so the community-based organization would call the local public health authority and talk them through the information on the phone. The local public health authority would look for the person or their contact in the system and then either approve or deny the request. We here at Oregon Health Authority are also trying to work on other technology solutions for folks to send this information in a secure way. Stay tuned for more information on this. Do you need help or have questions about any of the information in this training? Your Community Engagement Coordinator is your go-to resource. Here are the pictures of our fabulous teammates. We are a new team and we're very excited to work with you. We're all learning a lot and might not always have the answers to your questions right away, but we're committed to finding an answer for you. Here is a map of our community engagement coordinators and their assigned regions. Still not sure who your community engagement coordinator is? You can email our general inbox at community.covid19@dhsoha.state.or.us. Thank you for your time today, and thank you for all you are doing to support the folks in your community. We hope that this training was helpful. If you have questions, please reach out and we'll be happy to help.